Acupuncture and herbal medicine helps increase blood flow to the ovaries, the uterus, the testes, and that, of course, is going to help fertility no matter how you are approaching it. In addition to that, it decreases cortisol, which is the stress hormone. It's a very greedy hormone. So it can, if your stress levels are up, cortisol can grab progesterone or grab estrogen and turn it into more cortisol. And that's something that you can't just control on your own, and acupuncture helps regulate cortisol levels. The Chinese medicine side of it believes in the quality of that egg as it's produced, and the egg cycle for each egg that is released is anywhere from like 100 to 150 days. So we have 100 to 150 days to actually influence how well that egg develops and how the quality of that egg, each individual egg as it's being developed and before it becomes a follicle.
Ultimately, the goal is to get pregnant, right? That's usually why women come in. And then often we see that they are pregnant and then we don't hear from them again. But why is it so valuable to focus on that time directly after conception and, for sure the first trimester, but even through the pregnancy and beyond?
Acupuncture, I always say, like, once you get that positive pregnancy test, you're still here. We're still treating you, because it can help diminish the side effects of a pregnancy, the first trimester, which can be pretty hard for some women, and nausea. It helps with nausea. It helps with fatigue that comes into play during that time. So I always want women to continue to come in during that first trimester once a week, at least, more often if it's severe, they're having severe issues. It just helps them during that first trimester greatly. And then moving on from there, the second and third trimesters, I always want women to come in there. There are times when you're pregnant, you cannot take certain Western medications anymore for insomnia or depression, anxiety. There are certain things you just can't take for pain as well. So acupuncture, it doesn't have any side effects in that way.
All right, so we are here again with our series of videos on collaborating with healthcare professionals. And I couldn't be more excited today. We are here with KJ Sauer, who is not only a licensed acupuncturist and herbalist, but is also a dear colleague and friend of mine. And we work together every day. So I couldn't be happier than to have her on with me today. And we're going to talk about fertility and women's health. So KJ, welcome. Thank you for being here. I'm excited to chat with you.
Yeah, thanks for having me.
Absolutely. So we're going to focus on fertility today, and then we'll do some future ones as well. But in regards to fertility, this is an area that in the acupuncture and herbal world has become increasingly more valued and more people have become interested in it. So the first thing that we want to kind of cover is how does acupuncture help with fertility? This is something that's going to be the first question for people that don't know that this is even possible. So tell us a little bit about that.
Right. So typically what I tell our clients is that acupuncture and herbal medicine helps increase blood flow, and that to the ovaries, the uterus, the testes, and that, of course, is going to help fertility no matter how you are approaching it. In addition to that, it decreases cortisol, which is the stress hormone. It's a very greedy hormone. So it can, if your stress levels are up, cortisol can grab progesterone or grab estrogen and turn it into more cortisol. And that's something that you can't just control on your own. And acupuncture helps regulate cortisol levels. If it's too low, it raises it. If it's too high, it decreases it. Usually it's too high during this process. So it helps with stress. It also regulates your cycle, your menstrual cycle, which is always helpful when you are trying to conceive. A lot of women who come see us have long cycles, too short cycles, typically too long, and are struggling. That way, it's hard to know when you can conceive if you can't pinpoint ovulation, and acupuncture helps regulate your cycle enough to where you can kind of know where the window is to conceive as well. It increases sperm motility and volume in men as well. Yeah. And so those are the main areas. To go back to the first thing that I touched on with increasing blood flow, it also decreases inflammation. And when you are trying to conceive, keeping inflammation at an all-time low is always going to be beneficial also to be able to increase your odds of conceiving on any given month. Yeah, that's great. It's one of the things that our medicine really focuses on is this relationship between mind and body, right? And so, this relationship of there being an increase in blood flow, like you were speaking about, a decrease in inflammation. Those are physiological or body markers. And then you have a decrease in cortisol level, which is really related more to the emotional body, the mental kind of rumination and some of the things that come up that create a higher level of stress. And being able to kind of see both of those at the same time and manage them. And that's really one of the strengths. So that's great. What about the order? So do you think of it like, the first thing we look at is cortisol, or the first thing we look at is the menstrual cycle and regulating that? Is there like a kind of direction that you take people through, or not necessarily? Not necessarily. I just kind of meet the best case scenario with Chinese medicine, and when it meets with the Western side, infertility overall through the studies that I've been reading, is that just to meet the person where they are. And, we're not going to just start tackling stress and then we'll figure out they're all, of course, intertwined, holistic health. Absolutely. Once we start, dealing with everything kind of falls into place. So if we can keep your stress level down, stress can directly affect your cycle. So if your cycle then becomes regulated, your ovulation becomes regulated, your stress and inflammation are down. So it's kind of a package deal. Like once we start treating you, some things might come up along the way, of course, but like as you're regulating your cycles, things might get shorter or longer for a period of time, but end result is, usually an improvement that will help. So no, we're always going to treat everything that you've got going on when you come in on a daily basis and throughout the course of your treatment as well. Yeah, great. And so is it, are we only treating patients that are trying to conceive naturally, or what about patients that are already going through IUI cycle, an IUI cycle or an IVF cycle, these kind of like assisted reproductive cycles that we go through from Western medicine? Can you talk a little bit about that as well? Yeah, the same reasons that I gave for why acupuncture can help with fertility in general for people that are trying to conceive naturally are also the same reason. So no, we all across that spectrum, donor eggs, non-donor eggs, IUI, if this is your third IUI and you haven't tried acupuncture before, this is the time to try it. So it can help for the exact same reasons that it helps natural conception as well, assisted and natural both. Yeah, and it's great. And one of the things that I find is that a lot of times what we're looking for is kind of the missing link, right? So sometimes, with an IVF cycle, there's a high focus on being able to retrieve the egg at the right level, but sometimes you don't get enough healthy eggs. And so then it's just looking at it a step behind that is how do we help produce healthier eggs, Healthier eggs. Right. So sometimes there's that component of it of like, how do you fill in the gap that's being left out either in the IVF process or the IUI process that just may not be getting addressed. Right. And in the Western side, really, the Western side has a tendency to kind of create this dark picture of, you're born with so many eggs, and they always like to draw these charts that go down and how your your fertility decreases in age and you're running out of time. And it's very stressful, but the Chinese medicine side of it believes in the quality of that egg as it's produced. And the egg cycle for each egg that is released is anywhere from like 100 to 150 days. So we have 100 to 150 days to actually influence how well that egg develops and how the quality of that egg, each individual egg as it's being developed and before it becomes a follicle. So we believe that, and we have seen through our practice that we can influence that, whether you're conceiving naturally or an IVF cycle or an IUI, it's just going to help increase your odds of conceiving as well.
Yeah, fantastic. So if someone's trying to conceive, either naturally or with assisted, when should they start the process, coming in, and then how long does it typically take?
So naturally, I typically will tell people that, it depends on some factors. If you have a lot of other issues going on that we need to also get ahead of as far as digestion, that sort of thing, it may take a little bit longer to regulate your cycles. If your cycles are already perfect, if you already have this 28-day cycle and you already know when you're ovulating, it'll probably take less time. I would say like 3 to 6 cycles for women in that case. If we are dealing with women who are a little older or a woman who has PCOS, just different factors come into play, then I would say 9 to 12 cycles before you will start to see your cycles regulate. I'm not saying that it's not going to happen the first month. I'm sure you've seen that as well. But it's best actually to have a run up of three cycles before you actually want to conceive. So even women who are thinking, I'm going to think about this next year, if you have irregular cycles or painful periods, any sort of issue like that, you should be coming in as soon as possible to really get on top of your nutrition and your cycle regulation before you actually start to try to conceive. Anybody who comes in, I'm like, just start pretending like you're pregnant right now. Start eating that way, start exercising that way, sleeping that way, just start treating yourself, as if you were already pregnant, because that's the best way to produce the best results. And as far as the assisted therapies go, 3 months before leading up to an IVF or an IUI is what's ideal. And that's the whole medicine where we're doing herbs and acupuncture leading up to that transfer date, the projected transfer date or the procedure date for the IUI. Ideal doesn't mean it's a wash if it's, if you can't do that. 6 weeks is still great. The original study that kind of put Chinese medicine with the Western side showed that even a treatment on the day of the transfer greatly increased the odds of it working. If you did acupuncture right before you had your IVF transfer done, it increased the odds. That's actually what kind of started the whole. That was back in 1990, late 90s. So since then, it's really, come a long way since then. But that's when people perked their ears up and started to see that we could actually have an effect on how effective those therapies are.
Yeah, and that's great advice to kind of think about it, even if you don't have any question that there's going to be potentially a challenge, but you have irregular cycles and you have, say, painful periods or something of that nature, to just start the process at that point, because you're much more likely to have a positive experience with conception if your cycle is regular. And so if you're
Correct.
Thinking that ahead of time, the same way like you were describing, if you're going through an assisted, an ART, an assisted reproductive technology, and you want to start a few months ahead of that, think of it the same way. If you're thinking of that, that's great advice. I hadn't thought of it that way. That's really fantastic. So good. What about to the physicians out there and, the OBGYNs, the fertility specialists, what would you say to them about, how acupuncture and herbal medicine can work with them in partnership? Because one of the things that we really promote is being, collaborating with other medical professionals. It's something that is necessary. There's no one medical field that can do everything. And so one of the things that we've had over the, we've dealt with some medical professionals that are super open to it and some that don't want any part of it, right? So how do you approach that in that conversation with the fertility specialist or the OBGYN?
I would just say that together, if we work together, staying in our own lanes respectively, that we're going to achieve more for, we're going to increase their rates of conception. And if we are helping with their clients keep their stress levels lower, it's going to help them achieve what they're trying to achieve. And we're both going for the same goal. The patient's going for the same goal. Everybody wants to conceive here. So we're just going to help each other increase the odds there with any sort of assisted therapies. And I love working with reproductive endocrinologists, the ones that are open to it. It's great. You learn so much. And then the client really feels like they have a team working for them. I mean, it's such a stressful process, to be trying to conceive and not able to, or having issues in that way. And, I see a lot of them that take so much of it on themselves and feel like if they're not positive enough, they can't control their own stress. And I tell them, even if you were had a traffic, jam that you were in, that can cause stress and you can't control the world around you. So acupuncture just greatly helps in this area with them. So I feel like we're just want to be part of the team, the complementary team that can help the reproductive endocrinologists achieve what they're trying to achieve for their clients, for the patients.
Definitely. And that's the ultimate goal, is that you get the best of both worlds, and we respect each other. We want to help, for the sake of the patient and their goal, so that's great. Fantastic. So, I know there's still tons to talk about around, just the process itself, but I wanted to ask you about treatment after women conceive, and what the process is as we move from, fertility into conception and pregnancy, and then even postpartum. What are your thoughts, philosophies on that process of, ultimately the goal is to get pregnant, right? That's usually why women come in. And then often we see that they are pregnant and then we don't hear from them again. But why is it so valuable to focus on that time directly after conception and, for sure the first trimester, but even through the pregnancy and beyond?
Acupuncture, I always say, like, once you get that positive pregnancy test, you're still here. We're still treating you, because it can help diminish the side effects of a pregnancy, the first trimester, which can be pretty hard for some women, and nausea. It helps with nausea. It helps with fatigue that comes into play during that time. So I always want women to continue to come in during that first trimester once a week, at least, more often if they're having severe issues. It just helps them during that first trimester greatly. And then moving on from there, the second and third trimesters, I always want women to come in there. There are times when you're pregnant, you cannot take certain Western medications anymore for insomnia or depression, anxiety. There are certain things you just can't take for pain as well. So acupuncture, it doesn't have any side effects in that way. So we treat a lot of women for sciatic pain that happens, carpal tunnel pain. There are different issues that can arise during a pregnancy that acupuncture can help with at Western medicine. They're just kind of like, there's not much they can do when you're carrying a baby at that point. So I think it could really help during the entire pregnancy, and then leading up to delivery. I always want women to come in once a week because it can help your body prepare for delivery. And then of course, when we get to the point of actually delivering, we see a lot of women who come in who are past their due date and aren't able to nothing's happening, and their doctors are telling them, okay, well, you've got this much time and before we induce you, and acupuncture can help with that as well. Just to help your body. It's all about blood flow. It's all about having your body's not going to do anything it doesn't want to do, but the acupuncture definitely helps your body do what it wants to do. So it's great for that. It's also postpartum in the recovery, depending on how your delivery went, it can help with issues of if you lost a lot of blood, if you're feeling fatigued. It is hard sometimes for women to come in when they've also got this new human that they're taking care of. So that is kind of a harder time to get them to come in, but we can definitely help in that area as well. We help with breastfeeding issues. If your milk isn't coming in as much as you want, we have points for that. We have herbal formulas for that as well. So we can help during that process as well.
Yeah, for sure. No, that's great. That's great. And those are two really important areas. Postpartum, it's very common that people are depleted right after, delivering. And like you said, it's almost impossible, especially with first-time moms, to let them know that it's okay to continue to take care of yourself. And it's important really for the baby. The same way when your kids get older and, you want to take time for yourself to kind of be there so you can show up for them really well. It's
right.
Like you want to start that process off really strongly at the beginning. And the other thing that I want to touch on that you mentioned, is that first trimester, in addition to the side effects, there's also, people don't like to talk about this, but the miscarriage rate is extremely high, even when it's not, even when it's just a normal conception, when you're not needing any assistance in any particular way. So we don't want to, we don't want you to have to go through all of this challenge of conceiving and then, not have the support through that first trimester to help maintain that pregnancy. And so it's just another piece that I think comes up a lot, so.
Right. And breech babies. Don't forget the breech babies.
Right.
We can also, there are points that we can do to help women turn breech babies, typically around weeks 34 to 37, I think is the window. Yeah. So if you find that that's happening, then we have methods of helping you turn the babies as well.
Yeah. The earlier, the better, right?
Yeah.
Yeah, good stuff. Good stuff.
Absolutely.
Well, and this is great. I mean, look, you're a mom. You've got two boys. You know how it is to relate to pregnancy, childbirth, getting the postpartum phase all the way through where they are today. And so and you have the skill to help with the actual treatment that you do. So it's a great service. You're the perfect person for people to come to for this. I can tell you, people from experience that, my wife, we were having trouble conceiving and until she started doing acupuncture and herbs regularly, which sounds weird because I'm an acupuncturist. And so you think she was doing it regularly, but she did start doing it very regularly after a while. And that was the thing that really pushed it over the top. I mean, we had done a lot of things prior to that. So from personal experience, we know that, and from clearly what we do in the clinic every day, we know this works, and we're happy to help. So thank you. Any last words that you have for the audience?
I'd just come in as soon as you can. I love working with fertility and the whole spectrum of it. And we've got great people that will help. The whole team there is experienced in it, and we all love working with fertility. So love to see people come in.
Well, this has been awesome. Thank you so much. I really appreciate your time and just working with you every day. So looking forward to the next one. We'll do some more soon.
Cool.
Take care, everybody.